Okay, we'll get started. So hi everybody, welcome. This is a webinar for people with MS and MS patient organisations to talk you through the COVID and MS Global Data Sharing Initiative. That is an initiative of the MS International Federation and the MS Data Alliance. My name is Clare Walton. I am the Head of Research and Access at MS International Federation. We are a network of 48 MS patient organisations around the world with links to many more. And I'm joined today by Professor Liesbet Peeters at the University of Hasselt in Netherlands. Liesbet is the chair of the MS Data Alliance, and she's also the chair of this project. Welcome, Liesbet.
Hi, hello everybody.
So why do we need to collect information on COVID-19 in people with MS? As I'm sure you all already know, COVID-19 is a viral illness caused by a novel coronavirus called SARS-CoV-2. Should have written that down. It originated in China and is now spread to many countries in the world, leading to the World Health Organization to declare a global pandemic. For many people, COVID-19 symptoms are quite mild and they can recover at home. But for some people, the disease is much more severe and they require hospitalization. Evidence emerging from the earliest places to experience outbreaks, such as China and Italy, are showing that older people and people with certain health conditions, such as high blood pressure, heart disease, lung disease, and diabetes, are at a greater risk of developing a severe COVID-19 disease and to sadly die from COVID-19. Current estimates are that between 1% and 4% of people who develop COVID-19 will sadly die from the illness. So what about people with multiple sclerosis? Is that a health condition that puts people at a greater risk of either catching COVID-19 or developing a severe disease? At the moment, the answer is we don't know. There are no signs at the moment that people with MS are at an increased risk. But the problem is there are too few cases developing in each country to be able to properly answer this question. We need to collect data from more people with MS on COVID-19, and we need to pull the data from as many countries as we can to give us the evidence that we need to start to answer this question. Currently, the advice being given to people with MS about COVID-19 is based on expert opinion from neurologists around the world who can make the best guess at how people with MS might fare if they develop the illness. But we need to do better. We need to collect data, and we need that advice to be based on real evidence of how COVID-19 interacts in people with MS. And that is the urgent need for data collection. People with MS and clinicians who are caring for them all around the world have questions about COVID-19. And it's not just about whether people with MS are at increased risk. They also have questions about different disease-modifying therapies for people with MS. They want to know whether certain therapies are increasing people's risk or will potentially mean they will have a more severe infection. So the Global Data Sharing Initiative was really set up to begin to answer these questions by collecting data from people all around the world. So I'd like to bring in Liesbet now, Professor Liesbet Peeters, to take us through some of the questions that you may have about the data initiative. And there will be plenty of time as well for you to ask questions as they arise. So Liesbet, thank you for joining us. Could you explain to the people listening how the Global Data Sharing Initiative works?
Yes, so I will do this super simple because I am a data geek and nobody would like to have the technical details, and that is fine. So we can just all assume that the technicalities are done and the experts are figuring it out. But how does it, very simply put, how does it work? People with MS have to collect data, and they can do this using a registry. And a registry is actually an initiative that is usually endorsed nationally and brings the data from one country usually together. Sometimes there are indeed other initiatives that are a little bit more broader. We call them regional COVID-19 surveys, um, or people can enter data into a specific platform. So there are several ways to collect data. It doesn't really matter which method or way you choose, you just have to do one of these options. So you can collect data via a national MS registry, via a regional COVID-19 survey, or go directly to the Global Data Sharing Initiative. And it depends a little bit where you are in the world on what method or way is the best. And I think, Claire, in the next slide, you envision it, how it goes global. Oh,
Yeah, so it was just to add here that clinicians all around the world are also collecting data on people with MS, and they can input them into the Global Data Sharing Initiative as well.
mhm.
Yes. Oh, I think we're going to go through the registries in a little, in the next set of slides.
Okay.
Yeah, so sorry, Liesbeth. Yes, the first thing, as Liesbeth said, is to find out if there is a regional or a national registry or survey that you can take part in. So you can see them here. Sorry,
Yeah.
you carry on, Liesbeth.
Yeah, exactly. So dependent on where you are in the world, and because it is a global initiative, it is sometimes difficult to give very clear guidelines. Um, so that is where this map really helps. Uh, So if you are in the US, there is, for example, a very good initiative, I Conquer MS, that is originally from the US, but is actually also our go-to place for everybody in the world that does not have a registry in their own country. So it is in English, but it can be used anywhere where you live. For example, if you live in Finland or in Belgium or somewhere in Africa, you can also join the I Conquer MS initiative as long as you can report in English. And then there are, for example, two very good initiatives in Latin America, one that is more Portuguese based or one that is Spanish based. So again, you can go to the ABEM survey here if you would like to prefer recording in Portuguese and you live in a different part of the world. So actually, for the Global Data Sharing Initiative, it does not matter which registry you choose, as long as you do something. So that is the only call to action we have. Collect data and share it with a registry or a initiative that is participating. So there are local recommendations depending on where you are, and we are fine tuning this while we go ahead. But if you have questions about what is the best option for your specific country, we can always help you with fine tuning these recommendations, which are quite global on the website, because of course it is a global initiative and we aim to activate literally every person with MS in the world. For the data collection, it does not really matter if you have COVID-19 or not. The data is useful anyway because we will have to have control groups. But we are definitely also looking for COVID-19 cases. So it is even possible to report as a family member on somebody who is in your family suffering from COVID-19, because we need that information as soon as possible. So I don't know if there are questions here already, Claire?
Yes, so I guess just to recap that, so if you want to take part, you find a national registry that is open to you based on what language you speak or where you are in the world, and you sign up. But there is also the option to enter your data directly into the global platform, and we have forms available to do that in English, Spanish, and French. So yeah, does anybody have any questions on what we've talked about so far?
Hi, this is Iman from Kingdom of Bahrain, Middle East. There is no surveys within our region.
No, there are worldwide surveys that are open to anyone, but unfortunately there aren't any in, all languages are not available. So for example, we don't have anything in Arabic.
No, it is in, I mean in English, but in our region, in Arab words.
So there isn't a dedicated survey that is just for your region, but you could take part in the iConquer MS survey, which you can see is open worldwide, and also, well, actually, so is the Australian MS longitudinal study, although it's focused mainly on Australians. It is open worldwide, and there is another survey called the iCompanion app that is opening soon, and again, that will be open worldwide. So it's quite complicated, although there isn't something specific for the Arab world. You are welcome to use any of these initiatives that are open to the whole world.
Thank you.
And then, of course, the other option is you can go directly to our global platform and input data directly. And we have those surveys, those forms available in Spanish and French and English.
Yeah.
Thank you.
So yeah, exactly. So indeed, we want to be as inclusive as possible, because we believe that is the only way we can have the amount of data we need. But it does complicate the recommendations a little bit, because we give you, of course, the freedom to choose. But indeed, iConquer MS, the Australian MS longitudinal cohort, and then the German app, depends on which one you prefer. Most people go to iConquer MS. It takes about between 10 to 20 minutes to fill in the survey of iConquer MS. If you think this is too long, you can go to the central platform, which only takes up to 5 minutes. It depends a little bit on how motivated you are. iConquer MS has the advantage that it will support long-term research better than the central platform. So it requires a little bit more time of you, but it will be more usable in the long run if you report via iConquer MS compared to the registration directly into the global platform. But if the question is, should I choose the central platform or don't do it, then use something. That is the only call to action that is super important that everybody remembers. Everybody should feel the responsibility to contribute to this urgent need for data. We will only be able to address the questions if we really have a lot of data, because there are not so many people with MS. On top of that, there are not so many people who get COVID-19. All of that is a good thing, of course, that it is a rare event, but that also means that we have to massively scale up. And because there are so many factors that that are important, for example, age, gender, and so on. And that's why we need so much data.
Okay, that's so Liesbet, once people do choose one of these registries or surveys to join up to, what kinds of questions will they be asked?
So we try to limit the number of questions to the absolute minimal. And there was this global task force who agreed upon this is the minimal information we need to address these important questions. For example, does it matter which treatment I am currently using uh, about my COVID-19? So the questions that are asked will be, what is your age? What is your sex? What is your height? What is your weight? So those are more things that are related to yourself and your health. And then we need more information specifically on your MS course. And that's why we asked some questions on that. How long are you currently already, uh, how long do you currently already have MS? These kind of questions. And then, of course, to investigate the effect of treatment, we have to know which current treatment you are using, how long you are using it, and so on. And then, of course, because we are studying COVID-19, we need information on that as well. Do you have any symptoms? Are you self-isolating? Were you in a hospital? Are you recovered? So we need to have these answers to these questions to address the research questions about what is the effect of a specific treatment on COVID-19.
And then I guess just to add, depending on which survey you take part in, some ask other questions. So some may also ask about the impact on COVID-19 and your mental health and well-being, your employment, or the availability of healthcare. It depends which survey you decide to take part in to exactly what you'll be asked, but you will definitely all be asked the minimum questions that Liesbet has just gone through.
Mm-hmm.
Claire, there's a question in the chat which addressed to Liesbet. It's Zoe here. How many times can you complete the COVID questionnaire because things may change from one day to another? That's from Christian Thion in Belgium.
Yeah, exactly. So most studies allow that you report several times. And that is, of course, super useful to do research because it will change over time. It is not because you do not have COVID-19 symptoms today that next week you will not have COVID-19 symptoms. And if you report in a registry like I Conquer MS, they will send you requests to update your data regularly. And then indeed you can update your data and you will get pop-ups that it is necessary to update your data. It is, however, very important that you stick to one registry. So you can report as many times as possible in one specific registry. So you can go to I Conquer MS and report 2, 3, 4 times. But what you should not ideally not do is report in 4 different registries, because we do not have information about who you are, because it is completely de-identified. So we do not know which patient is behind the data. That also implies that if you collect data in 4 different registries, we will assume that you are 4 persons and your signal will be 4 times as loud as another person. And that is, of course, not what we want. So you can report as many times as you like, as long as you stick to one registry. If you have chosen for the central platform, which is completely de-identified from the scratch, you can only report 1 time because there it is already de-identified from the beginning. And this also implies that we advise you to wait to report into the central platform when you had COVID-19 and you recovered from it, because you only have one snapshot to actually do a proper recording.
That might be a bit clearer if we go on to this question. So Liesbet, what happens to people's data once they have submitted it into the initiative?
Yes, so indeed, so when you go to a national registry, they will sometimes ask you for data that feels a little bit personal. So they will sometimes ask you for your email address because they want to recontact you. However, when the data leaves the national registry and they share it with the central platform, then the data is stripped from all what we call identifiers. So identifiers are variables that could trace back to an individual. And an email address is a very obvious identifier because we could identify you via email. And all of that data is stripped. So the only thing that is shared with the central platform is the absolute minimal data we need to answer the questions we have.
And I think this diagram just reiterates what Liesbet said. So if you choose to directly input it straight into the global platform, the data that's collected there is already anonymous. So we don't ask you for anything that could identify you as a person. And for that reason, you can't go back in and update your data if you later develop COVID-19. So it's best to try to use one of the national registries if you can, find the best one for you. And then if you can't and you've had COVID, then you can report into the global data sharing platform directly. Is that clear? Does anybody have any questions at this stage? Are there any more in the chat? Or are we okay?
Yeah, there's one more question, Claire, Zoe again, for both of you. How do people decide which platform is better than another, or which is best for them?
Yeah.
So
I don't know whether you can answer that.
yeah. So so one important thing is, of course, the language barrier. So most of the global initiatives are in English, and that can be an issue for if you're not used to reading and answering in English. So that is why, for example, Portuguese initiative or a Spanish initiative could be better for that specific person because it is a language that is much easier to understand. So that means what can mean best. And of course, another quality criteria for a registry, which is also again very personal, is that a specific registry does have their own specific questions and missions. For example, indeed in I Conquer MS, they will ask you for questions more related also to well-being, to the effect of COVID-19 and isolation. So those registries will be used also to address other research questions that are outside the scope of this initiative, but are of course very meaningful to endorse. So that is why quality is always a little bit in the eyes of the beholder. And this is the same thing for registries. If you are only interested to contribute to the short-term need for data and you will not invest too much time in updating your data, then, for example, the central platform is the best because it is fast and it's only one shot. If you are interested in contributing to long-term research and also to other research questions, then other initiatives can be interesting. A very good example is Holism, which is Australian based but also accessible worldwide and is usually used by people with MS who are interested in a more holistic way of living. So they are already part of these registries because of the lifestyle they have chosen, and then they choose this registry because they are interested in the vision and the mission of that registry. So this is, besides a very important exercise on how can we address questions on COVID-19, also an awareness about data collection in general. Ideally, everybody knew already all these registries, and then we would not have so many questions on the differences in these registries. And now we have to educate also on the mission and the vision and the value of a registry. So in short, when is a registry the best? When you align with the vision and the mission of that registry, and when you understand the language in which they are asking you questions.
Thank you, Liesbet. Excellent answer, I think.
Okay. So Liesbet, we are getting the data in. What are the questions that we're going to answer in this initiative?
So we are definitely focusing on the short-term needs, as well as being very aware of the fact that the data is quite limited in size during the pandemic. And this is why we are focusing on the questions related to COVID-19 severity in relation to the effect of a disease modifying therapy. So simply put, what is the first questions we aim to address as soon as possible? Does it matter on which treatment I am to actually have a worse COVID-19 outcome? Let me reformulate. Do you have a greater risk to be hospitalized or to have, for example, an ICU stay if you are on a specific drug? So that is definitely the first question we aim to answer as soon as possible. So we hope to give insights on whether, for example, interferons are more protective compared to another drug. And we also believe that that is a research question that we can feasibly address during the pandemic as soon as possible.
And where are we? So we launched this initiative 6 weeks ago. What progress have we made so far?
Yes, so indeed, so we managed to have 22 data partners on board, which means that we activated almost every continent in the world. And indeed that there is a massive choice to choose from, but that is a good thing. So it might feel complicated that you have so many choices, but the fact that so many data partners have teamed up to join our mission is really more than we could ever dream of when we started this. So this means that in a massive shortly time, we had 7,330 people with MS report their data in one of these initiatives. And currently we are in direct communication with 10 of the 22 data partners. The other ones are doing everything they can to be in as well as fast as possible. And everybody is doing everything they can. We also have 437 cases reported by clinicians. Usually these are more severe cases, and they are very interesting for us to actually assess this risk of being a severe case. So in total, we currently have 624 what we call suspected or confirmed COVID-19 cases. So that means that these cases can actually be used to address this specific research question I was talking about. So although that this is a success, this is not enough. So this is very clear. If the numbers stay this low, although it is maybe already high, we cannot do any analysis on this data. The only thing the data says is that we need more data. So everybody should feel this urgent need that we are feeling, and we are working as hard as we can to get everything up and running, but we need more data, and that is really important. So I really hope that you can activate firstly yourself, and then everyone you know. Be as vocal as you can, talk to everybody you know, post it on social media, talk to your relatives, do everything you can to be as vocal as possible, that that this what you have learned today distributes across the world, and every person with MS feels the responsibility to contribute to this joint urgent need.
Thank you, Liesbet. I've just seen a question pop up, which is where and how often will you publish the results and updates? So I will just click onto the next slide and answer that. So the primary way that we will be communicating the results to people with MS will be through the development of global advice for people with MS. So at the moment, as I mentioned earlier, this has been developed based on expert opinion from neurologists around the world who have reached consensus on the best advice that we can give people. But as soon as there is this global data has been analysed and we are sure that we have enough results to be confident in the findings, we will regather the group of global neurologists together to review that data and to reformulate and update our advice so that the advice that we are giving to people with MS really is based on the best evidence available. And this advice is translated into numerous languages and shared both through the MS International Federation website, but also distributed across the network of patient organisations that we work with. So it will reach people with MS that way. But we also want to make sure people with MS can actually see the data and can come and see the data. So as soon as we have confidence in the results, we will be arranging webinars like this one to present the data back to you. And we will arrange those as is needed. So if the kind of the key messages and the conclusions from the data change, we will of course arrange another webinar to update everyone on what that change is. The best way to stay up to date with this initiative is to sign up for newsletter updates. You can see on the screen the link that would take you there. You can also find it quite easily on the MSIF website. And we will be using those newsletters to share the top line results and to publicize the webinars as and when they are developed. Of course, we will be publishing the results in scientific journals as well, but I just wanted to go through how we will be specifically communicating results directly to people with MS. Are there any more questions from anyone on the call?
Yeah, hi, I have a question.
Sure, go ahead, please.
Yeah, thank you for this webinar. I'm actually really excited by this effort to unite for multiple sclerosis patients. I actually have two questions, not one. One, do you think that this initiative can maybe outlive the COVID pandemic and kind of create a global repository for MS patients, beyond just local or national ones, and then so that obviously is beneficial because you gather data from around the world rather than just limited to specific populations?
So the idea is that we will definitely learn a lot about how we can massively and fastly scale up to address a certain research question. So we will definitely live past this initiative from a knowledge point of view on, okay, how did we do it and how did this community was brought together so fast, which is already very encouraging, I guess, for the
Right.
MS community, that within 7 weeks we accomplished something that usually takes 7 years to reach the same stage. So, and in that sense, I think it will be highly inspirational to outlive past the pandemic, to address other urgent questions, to lean on the same technical principles on how we addressed this question. It is too soon to tell how we will outlive this, because we also would like to be very focused. There is only one way here, and it is forward. And we cut so many corners in this initiative. And we will have to take some time after the pandemic to also evaluate how all of this went, and then include all these lessons learned to prepare ourselves for next questions that can be COVID-19 related or any other research question. So it is definitely my wish to do that, and it was also, and it is always the passion and the mission of for example the MS Data Alliance to accomplish that. But we specifically made this initiative to be fit for purpose, to be fast. So it is not really designed to be sustainable, because then it would not be fast. And it is not possible today to combine these two things.
Okay, well, that's something definitely to look forward to. Thank you for that. And then I also had another question, which was, so I guess you've partnered with MS kind of NGOs within certain countries or countries in particular, but have you partnered with academic institutions directly that kind of deal with MS? So like academic faculties or centers? Because I guess they might have like bigger outreach to MS patients directly as well.
Yeah. So that is definitely the intent, to do that, and to accomplish that, we will be working on more local recommendations. For example, in the European region, in that specific country, clinicians, please all go to that registry, because otherwise it is confusing. That is very clear feedback we got, because it is so inclusive and so broad. People don't really know how they are activated, and this is specifically also the case for clinicians, and that is why we are working to fine-tune the global recommendations in local recommendations and have them then endorsed by local societies, so that people can activate locally their own community, which will of course be more successful than these high level recommendations. We do still stick by the decision to go for a very inclusive and broad global recommendation, because we believe that in the complexity of a global data arena, this flexibility is necessary. But we are working on fine-tuning all of this so that every person, whether it is a clinician or a person with MS, knows, okay, this is my specific call to action, and then feels also this accountability to then do what is the specific call to action. So we are working on that, and we hope again to be ready as soon as possible. So the team is quite small, because none of us knew that we would be doing something on COVID-19. So I think that 2 hours after Claire contacted me, I dropped everything I had to focus on this. And many others have done the same. But of course, we are here in a world with limited resources and limited people. And that is why sometimes we are still going slower than we thought. So this also means that if you think that local recommendations for your network could work, and you would like to, and you want help to endorse it from us, then the more you actively also do something, the easier, of course, we will progress, because we are limited in size, and everybody who feels activated can definitely help. So if you ask, okay, in my country, I would like to have this as recommendation, is that okay? We can check it and we can say, yes, please, in that country, go ahead with your local communication, and we can endorse local recommendation if needed.
Can I also just add in response to that question? So the slide that we showed with all of the different initiatives on, that was actually only the ones that have been developed for people with MS to input. There are the same number, in fact, more initiatives all around the world that are aimed at clinicians. And so those really, obviously they are led by academic institutions in most cases, and they are doing their own communications and outreach to the communities that they sit in to make sure that clinician networks are activated all around the world as well. We didn't include that here because it makes it another 50 times more complicated, but that is ongoing as well at the same time.
Okay, that sounds brilliant. Thank you so much.
Does anybody else have any questions that they want to ask us before we say goodbye? Okay, I think not. So just to let everyone know, we have recorded this and we will be making it available on our website. So if you want to watch it again, or you want to share it with any of your colleagues or family or friends that you think might be interested, it will be available probably by tomorrow. Okay, and do sign up to the newsletter because we will keep you updated that way. But thank you so much for joining, everyone. Oh, I'm really sorry. I've just remembered there was one more slide, which we kind of covered already. It was just to say thank you so much for your participation. And please do get involved. Liesbet has already really strongly made the case that we need you, because together we can answer the questions faster and we can hopefully save lives during the pandemic. So please, if you are living with MS or you know someone that is living with MS, urge them to submit their data to their local, national, regional survey. Share our animation on social media. We now have it available in Arabic, English, French, and Spanish. So please share it and spread the word. And as I said, sign up to our newsletter so we can keep you informed as the results start to come out. And thank you so much to Liesbet for making time and for leading such an excellent initiative. Okay. Thank you, everybody. Bye.
Bye.